It is always important to have a monographic congress on psoriasis aimed towards a global audiences. It is the case with the P in 2016. And this has been a very important year because many advances in therapeutics have appeared in the last months and are quite ready to appear in the future months. So I would say that it is important that a general review has been done on the comorbidities and all the different aspects of the psoriatic disease, including psoriatic arthritis and all the comorbidities that impact our patients' quality of life and even their life expectations. On the other hand, I would say that a lot of focus has been centered on IL-17 directed therapies. In that respect, there have been many plenary sessions which have reviewed the general biology and immunology of psoriasis and the way in which the stop points can be modulated by therapeutic intervention. The main strengths of this meeting are, on one hand, the ability to interact with experts in psoriasis from different nationalities and different backgrounds, and to be able to receive the most updated knowledge in terms of both the pathogenesis, the genetics, the therapy, and the patient-oriented approach for the best care of our patients with psoriasis. There is no doubt that meetings like this one have a strong and long-standing impact on our therapeutic management of patients with psoriasis. I would like to stress that not only pathogenesis advances or genetic advances are important, but we must take into account a practical approach to the treatment of patients with systemic agents and the consideration that must be given to the psychological burden of the disease and the comorbidities of psoriasis, including especially psoriatic arthritis, depression, and cardiovascular comorbidities. My best memories of this Congress are related on one hand to the late-breaking news, which summarize the most recent advances in the therapy of psoriasis. There have been also very interesting reviews on the pathogenesis and the genetic and all the advances in our knowledge of this disease. And finally, I would like to consider that the genetic approach and the personalized approach, taking into consideration the different situations in different countries, have been some of the most helpful discussions that have been attended.